This short video is going to show you how to audit sepsis screening and Sepsis 6 delivery for the paediatric monthly audits at ESNEFT. So first of all, you're going to choose your patients that you want to audit. Try and choose as many as possible, so we've got a broad sample size, please. So next you're going to write the hospital number in the top section just here. And then you're going to ask your first question, was the sepsis screening tool started? So what you're really looking for here is just, is there anything written on the sepsis screening tool that would indicate they've actually done the sepsis screen? If there's nothing on there, then you write no, and you stop the audit there. If there is something written on, then you can document yes. We want to see that all children attending CAU and ED are having a sepsis screening tool started, and anyone on children's inpatient who has deteriorated, a new deterioration, then they should have a sepsis screening tool started as well. So next question you're going to ask is, was the child identified as not needing the Sepsis 6 pathway? So you're going to look at your tool here, so you can see they've gone through here, they've gone to the question of, could this be due to infection? And actually, let's say, for example, they've marked no, they've identified as not needing the Sepsis 6 pathway. So if this box is filled out, it means you answer in here as yes. Okay, so it says, was the child identified as not needing the Sepsis 6 pathway? Yes, they were. The other reason for their altered vital signs is maybe they are having a large GI bleed, and so that's why they've got altered vital signs. So the audit then stops. You don't then need to look to see if they have red flags. You just stop at that point there. If, however, they haven't signed this box and they've gone on to complete the audit and start looking for red flags, then you document in no, and you carry on with the next step. So you then ask, did the child have any red flags? So you can see here, when I'm going to audit, this child has got 2 red flags, so I'm going to mark in yes, and then I'm going to go on to my next step of the audit. If they have not ticked any of the red flags, and you can then go on to amber flags, and you can mark no in that section there. They don't have any red flags. So if they don't have any red flags, as it has documented here, you can now go on to the amber pathway for auditing. So you don't need to complete the red flag pathway because they don't have any red flags. So I'm next going to show you how you audit the Sepsis 6 section. So what you're going to do first of all is you're going to see if the child has had a senior review. So all children who have red flags should have a senior clinician review. So I can see here, so you're going to turn over onto the back of your sepsis screening tool, and you're going to look to see if the senior clinician has signed here. And we can see that an ST8 has seen the child, so it has to be an ST4 and above, and I can see that they saw them at 11:30, so that's my time 0. So I'm going to write in yes there. If this back of the chart is completely blank, so they haven't documented anything, you can go and look at the medical notes to see if the ST4, the reg, has actually written in the medical notes that they've seen the child round about the time of 11:30, and if they've mentioned about sepsis and the plan of care there, that is acceptable to say yes in this box here. We're looking for an audit of the sepsis care, not necessarily whether they've written on this form. Okay. So next question is, you then want to know, when the senior clinician came, did they agree that the child needed this Sepsis 6 to be given, or do they think there's another reason why the child is looking unwell? So if they did agree that they needed the Sepsis 6, then you write yes. So this child, you can see that they did because they continued on with the treatment. So I'm going to write yes here, and then I'm going to carry on with the next steps. If the senior clinician said, no, I think there's another reason why the child is unwell, then you would write no here, and you would stop your audit. You don't then need to say whether they did give oxygen to the child or whether the child did have antibiotics later on. You just need to stop your audit at this point. So for those children where they had red flags, they were seen by the senior clinician, the clinician decided, yes, we're going to carry on with this Sepsis 6. We're then going to audit step 2. So was oxygen administered? Now this row here, this column, sorry, here, indicates the answer options. So the options for answers are yes, no, or not clinically indicated. We're having a few problems where people who are auditing are saying no, that the oxygen wasn't administered, where what they really needed to write was not clinically indicated. So be really careful if you're saying no, did the child need oxygen? What you're saying there is the child needed oxygen and we didn't give it. So you just need to be careful there. So I can see here oxygen if required and it wasn't needed. Okay, so I'm going to write in there NA or not clinically indicated for that part of the audit. Children don't always need oxygen for the Sepsis 6. It's only if they are hypoxic. Step number 3. So to audit this one, did the child have lactate bloods and blood cultures? So I'm going to look at my chart and I'm going to see here they did get IV access and they did take bloods and they did that at 11:50. So I'm going to mark yes, that's compliant. Then going to go on to step 4. Did the child get IV antibiotics within 1 hour? And I'm going to look at that section and I can see there 12, and I think that says 23. So it's still within the 1 hour. So remember time 0 is 11:30. So it's given at 12:23. So I'm going to say yes for that part. They did get it within the 1 hour. Now there might be a slight deviance on this question in that you have got the option of saying yes, delayed antibiotics, but it was due to access issues. So if you have a child that's particularly difficult to cannulate, but the child is stable, the senior clinician might decide that they want to wait to try and get IV access before giving the antibiotics rather than going for IO, because the child is not sick enough for IO. They're not deteriorating, they're not going into septic shock. So if that's the decision that the senior clinician has made, then they need to have documented in here or in the medical notes that that is what they're doing. So then for these children, it's acceptable that you say that yes, they did give the antibiotics, but they were delayed, but the child has access issues, but the child was stable. You might want to document a little bit more information in this free text box about that too. So auditing step number 5, did the child receive IV fluid resuscitation within 1 hour? So I can look here that they've actually written that it was not applicable, and that's fine. If the child didn't need the IV fluid, they don't have to. So if they've said that it's not clinically indicated, so I'm going to put in there NA or not clinically indicated. Next one, step 6, is there evidence of inotropic support being considered? Now, again, this is one question where some people say no. So what if you answer no to that question, you're saying the child did need inotropes, but we didn't even consider it. So just be careful that maybe what you mean is that it's not applicable. So if I look at step number 6, you can see there they've written not applicable, so I'm going to write not applicable. Now, if they've left that blank when they've done this sepsis screening tool, you can then make a clinical decision. You can look in the child's notes to see, okay, were they deteriorating? Did they need inotropes and we didn't give it? Or have they said that the child improved after the Sepsis 6 or during the Sepsis 6? So you can make that clinical decision. If you're not sure, then please do ask somebody, go and find somebody someone senior who'll be able to help you with that question. So this question here, did the child receive the Sepsis 6 within 1 hour time frame, is really collating everything that you've documented in those 6 steps. So if you have answered no to any of these step 1, step 2, 3, 4, 5 or 6, then you write no here. If you had answered yes or not clinically indicated in all of those boxes, then you can document that as yes there. This one here where it says yes, delayed antibiotics, that counts as a yes. So once you've done that question, you're then going to go on to the next one, is looking to see if after we've given the Sepsis 6 treatment, if the child still has red flags, so still deteriorating, did they then get a follow-up paediatric consultant review? And I would consult the Pew's chart for this. to look to see what their pews are after they've had the Sepsis Six. You might look between 12:30 and 1:30, because we know that this was all given by 12:23. Did they then have follow-up observations or look in the nursing documentation? Were they worse after? Did they still continue to deteriorate? And what escalation did they get after that?